The COVID-19 pandemic has already put New York residents under strict limits in their daily lives, with businesses ordered to shut down and people told to isolate themselves. Citing those restrictions and New York's success in becoming a leader in testing people for the coronavirus, Cuomo said, "In many ways, we have exhausted every option available to us." New York performed nearly 13,000 coronavirus tests on Monday, bringing its total to more than 91,000. Along the way, the state's health experts have sought answers to vital questions such about how quickly the coronavirus spreads, and whether it can be slowed down. So far, the results are not encouraging. The latest rise in cases has forced a dramatic revision of the state's projections for how hard COVID-19 will hit people and hospitals in the state. In recent days, Cuomo has said New York would need around 110,000 hospital beds to deal with the crisis, more than double the 53,000 it currently has. Cuomo issued an executive order on Monday requiring all hospitals in the state to boost their capacity by 50% to meet the expected need. If the latest projections prove accurate, the state will have to find even more hospital beds now. It will also need many more intensive care unit spots. New York currently has around 3,000, but the new projections say that at the height of COVID-19's outbreak in New York, the state could need space for 40,000 people to be in intensive care at the same time. The state also desperately needs ventilators to help people breathe after their lungs have been compromised by COVID-19. New York has now procured about 7,000 of them. Its estimates call for an additional 30,000. The governor reiterated his call for the federal government to help ease the critical shortage, saying the Trump administration could use the Defense Production Act to compel companies to produce equipment. Another option, he said, would be for the government to use its stockpile of roughly 20,000 ventilators. After the coronavirus apex passes in New York, the governor said, the ventilators could be moved to other states where they're also needed.